know there's a national shortage of behavioral health care workers. And so our goal for this program is to bring awareness, to spark awareness for young minds so that they learn about careers in the behavioral health care field. We believe that we are building a pipeline of our future candidates.
So the Public Health Youth Ambassador Program is a program for Fairfax County high school students in grades 10 through 12, where they learn about public health and opportunities for secondary school and in careers within that realm. So students get the opportunity to learn from two wonderful curriculums, and they get to learn about the wide world of public health and opportunities for them within that spectrum.
So Spark is a cornerstone event for this Public Health Youth Ambassador Program. It's a cross-agency partnership between the Community Services Board and the Health Department. So they're going to be with us all day for a fun, interactive learning day.
Experiencing an event like Spark is wonderful for the kids because they get a chance to enjoy simulations that show them real-world circumstances, and they also get to interact with professionals and hear about their backgrounds and get a chance to frame their own careers based on the same.
This event really started from a need within our students. So every single year, our Public Health Youth Ambassadors are asked to create a community health project. And in this project, they have the opportunity to identify a problem within their community and propose a community-oriented, sustainable solution. And every single year, we saw the students saying mental health and substance misuse. And so we really saw this as an opportunity. And when we partnered with the CSB, it gave us the opportunity to not only connect this topic, but connect the students to systems that were doing real work to create sustainable change in communities. And so it was my responsibility to look at that need and think about how can we translate that from a need to an actual meaningful learning experience for our students.
The students were engaged in intentional activities to help them understand behavioral health. They first engaged with the Human Library, where they actually got a chance to talk to professionals in the behavioral health and behavioral health roles. And what they did with those professionals were they actually talked about what the professionals do every day. They heard unfiltered stories, and they went on to take advantage of a wellness room where they were actually engaged in wellness and creative activities, where they worked on mindfulness boards, they worked on thank you cards and other interactives. The last thing that the students were able to do was they were able to practice some hands-on activities where they actually were engaged in prevention activities and learning what it was to make decisions in the moment.
So first we had a maze, and so what the maze is it checks for your ability to recall, right? So a lot of our activity is about recall. So we give the maze, and first you will do the activity where you go through a maze without the goggles. And then we have you put them on to see if you can go the same way. And what you see through that is it's not as easy. So they start feeling the anxiety starts to ratchet up, right? And it's, well, I just saw this and I remembered it, but now I can't do it because now it's the perception of what you're looking at has changed. So that's what the goggles do. They impair your ability to do something you just did. What we're looking for is this is how things are if you don't have anything that inhibits you or is in your way or impairs you versus this is what things look like once you have barriers, inhibitors in the way. So we're trying to show the difference of those two things. My job was done when we did that, right? We showed, that was the point. The point of it all was to say, listen, we don't want you to enjoy this. So then when you're thinking about it, when you're with your friends, because peers, right, as the older they get, the more influence peers have. But them having their individual experience, we hope that these experiences stay with them so when they're out, at least they have perspective and they have something to hold on to, like, you know what, that may not be the best decision.
We didn't just want them to be passive learners. We wanted them to come in and be active participants, and we really needed to ask ourselves, what did we want the students to take away from this experience? They're not just Googling a career online, they're hearing about the lived experience about all of these individuals. And so they're able to break down barriers. Maybe they might not have access to these professionals or know about these careers, and so we're opening doors for them.
I can definitely see myself have a career in behavioral health. I've always been interested in behavior and mental health. I feel like it's one of the most important things that we really have to take care of as human beings, not just as adults, as teenagers, even in children as well.
I really like doing the thank you cards because I really like crafts. I think it's a really therapeutic thing for me, and it's a really good way to just relieve stress.
When I tried it without the drunk goggles, it was like I could see everything properly and it was easier to drive, but once I put on the goggles, it was like tripping me up a bit. It felt like everything was like close up or everything was like falling apart, you know?
I really think that there are two things that we're hoping to do. We're hoping to make sure that they're able to see themselves differently when they walk out of the space that they shared with us, and then also open the door to new possibilities. And so with those skills, we're hoping that they take it and know with certainty and confidence that they are people who can create change in their community.
This was a partnership that they came into and helped to just make it the capstone event that we were hoping it to be. So they were absolutely delighted.
So if I had to describe today in one word, I would describe it as inspirational.
Absolutely, I would recommend this program just because it gives you such a wide variety of information that you can pick and choose from, and it gives you just a general knowledge of all things public health and more specifically mental health.
If I had to rate this event from 1 to 10, it would definitely be a 10.
Let's make it happen together. Spark! Change!